Kia ora, welcome to this explainer video by Women's Health Action Trust. We will be exploring the social determinants of health. We often think of health as an individual issue, and choices like smoking or poor diet are blamed for illness. Did you know these choices account for just a small portion of health outcomes? Research has demonstrated that individual choices are often far less influential than social factors. Outside of the choices we make, there are tons of things influencing our health, from the quality of public transport in your neighbourhood to the degree of discrimination your community may face. The social determinants model helps us understand how each of these factors impact on our health. Of course, as we know, genes and behaviours do play a role in illness, but here are some examples of other things which often impact our health greatly and are usually out of our control. Whether or not you have a safe family environment, or if you are part of a community which protects and supports you. Living in an environment where you have good working conditions, transport, warm dry housing and education. Living in a country with low economic inequality and access to safe living conditions like clean drinking water. It's also important to understand that all of these factors intersect with who we are as people. Our age, gender, sexuality, ethnicity, religion and more all play a role in how these factors will influence our health. This is why when researchers study people who have the same health behaviours, people who are rich are still less likely to get sick than those who are poor. Therefore, health is not just a result of individual choices, but the result of social, cultural and economic factors.
In New Zealand, this is particularly important to consider as Māori people are disproportionately affected by the social determinants of health. Colonisation has caused economic inequality and discrimination, which has been linked to poor health outcomes.
When we construct health as purely an individual issue, we both ignore the root cause of illness, which often is social disadvantage, and we blame individuals for problems that are out of their control. Check out womenshealth.org.nz to find out more about the work we do in this space.